Communication is highly vital because it's about having the right language and having fluid conversations. And these conversations let go of the barriers that are in the whole stigma of mental health. Being able to have the safety, having a space of non-judgmental environment, a space of empathy, and also being aware that it's not every time we need to speak. Sometimes we just have to listen. So it's really about understanding the importance of how we communicate with one another. Sharing your feelings doesn't make you weak, neither does it make you incompetent. In contrast, it makes you look strong. To be able to share your emotions, it is important that we see it as having a human experience and not see it as a human burden. And I truly believe having the proper language and communication, it does break down the barriers, the stigma, the shame, the judgment, and for all of us to create a space where everybody is heard.
So from my own lived experience, I found that communication was key to everything in relation to my experience. I was an involuntary patient, which means I had to be admitted against my will to the services. It was my first time ever involved with mental health services, and I was terrified more, to be quite honest, of the services and the communication that I encountered around the services than I was of my actual illness, which might surprise some people, but for me that was my experience, because oftentimes the communication that I was met with was highfalutin jargon, medical terminologies. There was lack of communication as well in certain areas. From my own experience, I had to be knocked out for the first 2 days of my admittance to hospital, but no one explained to me that was going to happen, and I didn't know what was happening. I just woke up 2 days later in the hospital. And even in my recovery, I was across 2 jurisdictions, and there was no communication between the 2 jurisdictions in relation to my mental health and my recovery journey, only that I instigated all that myself. Communication is key, and it's paramount to everything in relation to mental health services and my lived experience, and there's definite room for improvement.
Well, I first had my experience with the mental health services when my sister Joanne had a mental health episode. And for me at the time, I didn't know where to go to get help. I didn't know how to navigate having her admitted into hospital. I found that I didn't have the skills that I needed or the knowledge that I needed to try and help her. I do think if I'd had those skills at the time, that I would have been able to ensure that she was admitted to hospital in a kind and in a sensitive way. However, it didn't actually work out that way for us. I think for that specific time, yes, there was good communication with me, but I think for Joanne it was a very different story. And that's the heartbreaking bit for me as her sister, when you come out the other side, is hearing from her how she was treated at that time. I think the communication we received after the event was very good, but I don't know if there's a lot of communication out there for people before the very first episode that somebody has. People don't know, like sometimes you have no warning signs of these things coming, and they happen all of a sudden and nobody knows how to deal with them.
The question of communication between mental health service users, carers, and their treating teams and the services, is one that comes up quite a lot. And really, it's at the heart of the recovery approach, ensuring that there's appropriate communication. And by that we mean that the person who's attending the meeting or the appointment understands exactly what's happening at the meeting, based on the knowledge that good communication is not just about transferring the information, it's also about ensuring that it's heard and understood. So it's about the practices and the principles around that. And what we really ask staff to look at from a reflective practice kind of point of view is that if it was their family member or themselves or their partner, whoever that was on the other side of the table, what would they want them to know about this service, this treatment? What kind of an experience would they want them to have? And I think if they stick to that, they're not going to go far wrong. It's a very person-centred approach, and we're always trying to co-produce and take feedback through our engagement mechanisms from service users to ensure that we're getting it right.